When you hear people talking about what the signs of labor are, they normally always talk about the exact same things, right? The baby drops, mucus plug discharge, bloody show, etc.
Yes, but in this video we are gonna talk about very specific signs of labor, signs which are related to your vagina, your baby's movements, your gastrointestinal system, but also general signs of labor that no one else is talking about, right? So pay close attention, because if you experience these signs, it could be that you are about to meet your little baby. Natalie here is a pregnancy and birth consultant and TCM therapist.
And Matthias is a researcher and science geek, and we help expecting mummies naturally and science-based.
It's great to have you here. Alright, so the things that we are gonna talk about are the signs of labor that you would normally observe between 1 and 5 days before labor starts. And please keep in mind that some women may experience several or even all of them. Others may experience 1 or 2 of them or none of them, right? It really depends on your body. So let's start with the general signs of labor that women often observe.
Right. So during those final days before labor starts, many women experience an increase of nerve-related pain. So this could feel like a sharp or shooting pain or a pressure-like sensation.
Yeah.
What's special is that at that stage, the pain will normally particularly focus on 2 areas, along the sciatic nerve as well as on the so-called lesser pelvis.
Yes, so what's the lesser pelvis? Well, a pelvis can be divided into 2 areas. The greater pelvis is basically everything above the so-called pelvic brim. The pelvic brim is just that oval-shaped opening that you can see here, right? And then we have the lesser pelvis, which is the area below the pelvic brim. So if you're looking for signs of labor, try to feel where the pain is coming from. Again, you're looking for nerve-related pain, mostly a pressure-like sensation, which is located in your lesser pelvis and or along the sciatic nerve.
Right. Next, we have heart palpitations. Many women report that they suddenly had heart palpitations during the final days leading up to labor.
Yeah.
Not consistently, it's more like irregular palpitations. And they often come with hot flashes as well as a general feeling of restlessness.
Yes, what's more is that women who are about to go into labor often suffer from headaches. And those headaches do not have to be focused on a particular area of your head. The reality is that different women might experience that headache in different areas of the head, right? It all depends on your situation.
Right.
But we are not talking about very strong and persistent headache, because that's actually a warning sign which might require you to see a doctor.
Right. On top of that, during those final days before labor starts, headaches are often accompanied by the feeling of blood rushing to your head. So similar to situations when you suddenly feel very angry.
Yeah.
So let's say you have been carrying that rock in front of you for 40 long weeks, suffering, everything aches, and then your partner comes along and tells you, Jesus, baby, you got big. Maybe it's time to lose some weight.
What?
That's the kind of blood rush we're talking about.
Who would say something like that? It's unheard of.
Yeah, if that ever happens to you, you are allowed to hit your partner as hard as you can.
Right, but I was joking back then, okay? Which apparently came across in a very bad way. Anyways, talking about losing weight, that's actually another sign of labor. In fact, it is not uncommon for women to lose some weight during those final days of their pregnancy. So we are normally talking about a weight loss of between 500 grams and 1 kilogram. So that's between 1.1 and 2.2 pounds.
Keep in mind though, it does not happen in every woman, okay? However, checking your weight regularly during those final weeks of your pregnancy could give you an idea if you are about to go into labor.
Exactly. And then another general sign of labor is lower back pain. Now, we do know that many people tell you that lower back pain is a sign of labor, so that's probably nothing new to you, right? But you see, lower back pain as a sign of labor can be different from random lower back pain.
Yes. So first of all, during those final days of your pregnancy, that back pain will normally particularly focus on the area of your lumbar part of your spine as well as your sacrum. On top of that, women often describe the pain as a pulling sensation.
Right. Keep in mind though that lower back pain is really not the most reliable sign of labor, because some women suffer from lower back pain throughout their pregnancy, even though the pain might feel different during those final days of your pregnancy, right? Moreover, the kind of back pain that you experience also very much depends on the position of your baby in your womb. For example, if your baby is facing your front instead of your back, the pain in your back that you experience might feel very different and much more intense compared to what we describe here.
Right. So those were the general signs of labor that women often observe during those final days of their pregnancy. Now, let's talk about the signs of labor related to your vagina. So first of all, it is not uncommon for women to experience more discharge during those final days of their pregnancy.
Yes, and we are not talking about amniotic fluid when your water breaks, which would be a clear fluid. We are talking about discharge which could be either white or slightly red or brown or even blood streaked, which can happen because the lower segment of the uterus is being pulled upwards, which helps to open the cervix.
Yes, but we do not talk about vaginal bleeding, right?
Yeah.
Because that's not normal.
Exactly. And we're also not talking about green discharge. In fact, when you observe green discharge, we really urge you to go to the hospital immediately because this can be a sign that your baby has passed meconium in your womb, which can be fatal for your baby.
Right.
When that happens, the baby needs to get out of there as fast as possible.
Right. And then another sign of labor related to your vagina is a feeling of fullness in the area of your vulva, which is the term used for the female external genitals. So the area of the vulva starts here, which is often called pubic mound, and ends here at the perineum. Again, if you feel a fullness in that area, it's often a sign that labor is very close.
Right. Next, we have the signs of labor, which are related to your gastrointestinal system. First of all, I'm sure that you know from other pregnancy resources that you might suffer from diarrhea during those final days of your pregnancy. So that's probably nothing new to you. We just want to add here because many women are like, I don't want to go into labor with diarrhea, and that's totally understandable. However, we just want to add here that suffering from diarrhea before you go into labor is not necessarily a bad thing.
Right. That's because your uterus is located right in front of your intestines. So by emptying your bowels, your body makes more room in your pelvis so that your baby can descend more easily during labor.
Yes, and then there are two more signs of labor that women often experience during those final days of their pregnancy, and that's vomiting and loss of appetite.
Yes, but we would not say that these are the most reliable signs of labor
Yeah.
because some women experience them throughout their pregnancy. So it's always a good idea to look for a combination of several signs of labor that we mentioned in this video.
Right, and then there is one more sign of labor related to the gastrointestinal system, and that's the pressure that you might feel on your rectum. And because of that pressure, it is not uncommon to be bloated during those final days of your pregnancy, right?
Right. Finally, there is also a sign of labor which is related to your baby and which really lots of women report. In fact, many women observe less movements of their baby during those final 24 hours leading up to labor.
Yeah.
In other words, a baby may be less active during those final hours before labor starts.
Yes, well, that's probably because they're busy packing their stuff and taking a shower before they set off, right? Anyways, please keep in mind that a less active baby can potentially also mean that baby is in distress, right? So please be extra careful and talk to your doctor if you have any concerns. Moreover, also keep in mind that every woman is different, and so you may or may not experience those signs of labor that we just mentioned, or maybe you do, but you still don't go into labor. There are no signs of labor which are 100% reliable. It all depends on your body.
Yes. By the way, some time ago we recorded a video in which we also talk about other signs of labor. And what makes that video so special is that we also explain why you cannot rely on those signs. So watch it if you like.
Yes, it should pop up now, but you can also find it in the description below this video.
Right. If you have found this video helpful, we would appreciate if you could leave us a like below this video.
Yes, and for more useful tips and tools on pregnancy-related topics, make sure to subscribe to our channel and hit the bell.